Our next patient is Marta Diaz. Her pronoun is she. The overnight nurse reported a good shift. The patient's only complaint was that she couldn't sleep, so they gave her a PRN dose of trazodone with positive effect. This morning, however, I'm pretty concerned. She's very sleepy, and I can't get her to stay awake to take her meds. I am uncomfortable with her condition, and I believe her safety is at risk. I have paged a Spanish interpreter, and she should be here any minute.
Good morning.
Buenos días.
My name is Dr. Ogi.
Es la doctora Ogi,
I'm the internal medicine doctor on the floor and taking care of your mom, Martha, today.
la internista que está atendiendo a su mamá en esta sección.
So I think the antibiotic is treating the urinary tract infection.
Creo que también el antibiótico le está funcionando para la infección que tenía de la orina.
But I am concerned, as you are, about her sleepiness.
Pero sí, me preocupa igual que usted, me preocupa ese sueño.
Kathy, let's listen to her. Craig, can you pull up the medications that she received last night?
Sure. So the nurse gave trazodone 50 milligrams at 9 o'clock last night, and then the nurse gave another 50 milligrams at 11 o'clock last night. So she had 100 milligrams in about 2 hours.
Kathy, can you remind me why she got the extra dose of trazodone last night?
Remember, Dr. Ogi, they had to give her an extra dose because she couldn't sleep. So she got 2 doses closely.
Okay. So we are going to stop the extra dose of the sleeping pill tonight.
Entonces, la medicina que se le estaba dando, la dosis adicional, esa se le va a eliminar, la del sueño.
I'm confident that by this afternoon, she will be walking around the unit and eating lunch.
Y estoy bastante segura de que esta tarde ella ya va a estar almorzando, va a poder caminar en la sección
And almost certainly can go home tomorrow.
y probablemente se va a poder ir a casa mañana por la tarde.
How does that sound for you?
¿Cómo le parece?
Well, gracias.
Sounds great.
Martha, you look great. How do you feel?
Marta, señora Marta, se ve bien. ¿Cómo se siente?
Gracias, me siento mejor.
Thank you. I feel better.
¿Por qué tenía tanto sueño?
Why was I so sleepy?
Yes. You are sleepy because some patients in the hospital, when they have an infection, they don't sleep as well. And so, in addition to your 9 o'clock sleeping pill, you got an additional 1-2 hours later, and it was probably just too much.
Se le había dado la dosis de la...
Can you repeat back to me how you're going to take the antibiotic and the sleeping pill?
A ver, si me puede decir en sus propias palabras, ¿cuántas veces al día se va a tomar el antibiótico?
2 veces al día,
Twice a day?
For how many days?
¿Por cuántos días?
por 3 días.
3 days.
And what about the sleeping pill?
¿Qué tal la de dormir?
Si lo necesito.
Only if I need it.
Correct.
Correcto.
We'll arrange everything for you to go home this afternoon.
Entonces nosotros arreglamos todo para que se pueda ir a casa esta tarde.
Marta, we're going to write the instructions in Spanish.
Señora Marta, las instrucciones se las vamos a poner en español.
So when we bring the paperwork in, you and your daughter will understand.
Y las instrucciones, las hojitas, se las vamos a repasar entre ustedes dos.
We will also fill your medication here in our pharmacy, and we will give it to you before you go home.
Y luego todas las medicinas se las llenamos aquí en nuestra farmacia. Antes de que se vayan a casa, van a tener las medicinas.
Do you have any questions?
¿Hay algo que le gustaría saber?
¿Y esas instrucciones van a estar escritas en español?
So, the instructions, they're going to be written in Spanish?
Correct.
Correcto.
Okay. And you will
All right.
leave the hospital with the antibiotic.
Y el antibiótico, le dan esa receta de aquí.
Okay.
El trazadón, como todavía tienen en casa, puede usar la que tiene en casa.